Do you hear it? Do you hear that? Apparently, you didn't hear it. It's the voice of your constituent. It's the person who called you on the phone, the person who emailed you. If you knocked on doors, Senator Bertrand, it would be the person that you would see at the door who would tell you their story about their child or their daughter or their sister or their mother. You would hear that. These are the people that put you into office. These are the people that were relying on you, Senator Schultz, to do something, to listen to them. How many of you put on your postcards or your mailings or even your Facebook page, "I listen to my constituents"? Do you hear it? Do you hear them? They've been talking to you since 2015. They've been telling you what their issues are around the new managed care system. They're not asking you to do anything above and beyond. They're just telling you that what has happened to them and their families is outrageous. So, who is Senator Yoakum talking about? She's talking about the most extreme medical cases. They're the waiver cases. And we have 7 different waiver programs in Medicaid. You have the regular Medicaid population where maybe it's a family and the kids need vaccinations and they need school checkups and they have a cold and, they need to go to the doctor. That's the population that doesn't use as much money in the Medicaid program as the waiver community does. For example, the person that you see in a wheelchair, the paraplegic. Now, I know all of you have received emails about cuts in services. We have talked to several, all of us have, paraplegics who used to have maybe 4 to 5 visits a day by a home health care provider to empty their catheters. Many of them have had their services cut back where they receive maybe 2 or 3 visits a day, where someone empties their catheter, someone who has not been trained for very long. The rate of infection has gone up, and that's a problem. Can you imagine being paraplegic and only having 2 visits a day from someone to turn you or move you or feed you? That's a problem. That is a problem where we see services cut for waiver cases. And that's the population we're talking about, is carving that out. We have the best minds in the state of Iowa to figure out how to do this, to create a hybrid system. But we had to go ahead and shove everybody into the big bucket of managed care, the first state to do that. And believe me, I've asked CMS that 3 times. And a couple of times, they've rolled their eyes and said, yeah, Iowa did this and only decided to try to get this transformed into 4 months, which was a big challenge. We started out very rocky, and that was a huge problem, especially with our waiver cases, with our waiver community. I think, Senator Reagan and Senator Yoakum have said this several times, that we're all one accident away from Medicaid. We really are. Some of us have great lives. We go on and we're all here and we don't even think of, we just get in the car and drive here and go up and down these steps and talk about all kinds of stuff in the caucus and we get going. Well, there are families that could never live the lives that we do. Never. And they were one accident away. They were one accident away, and it happened to them. Now they're asking you to help them. Do you hear them? Do you hear them? I would ask that you would approve this amendment and vote yes.